It's been 20 hours post-op, and I wanted to go through the post-op regime that I've been recommended from Zestige Private Healthcare. So you get given a pack like this. So first of all, saline spray. So you need to use this every couple of hours for day one, and then more frequently once all the dressings come off. So this is used to keep the scalp nice and moist. It's used fairly frequently, about almost every half hour or so after a couple of days. We can't wash our hair until about day 4. So after that, there's an antibacterial solution that you mix with water and then pour that over your head. And I'll go through the hair washing technique once I start using this. Now, pain relief wise, I must admit it was a little bit uncomfortable trying to get some sleep. You have to sleep up, try not to let your head touch the backboard. So as you saw last night, I was using a neck cushion. Now, although paracetamol is okay, I think it's probably best to get a pack of cocodamol. So I got this morning. Now I've never had codeine before, so I must admit I took one codeine tablet with paracetamol, and it's definitely controlling the pain a lot better than paracetamol alone. But do be careful if you're not tolerant of codeine. It can make you feel a little bit queasy and drowsy. So yeah, I'm feeling pretty relaxed, a little bit sleepy, but that's definitely suiting me better than paracetamol on its own. So another important thing that's given from the clinic are prednisolone tablets. So these suppress inflammation, they reduce swelling. Just be mindful that initially it's quite high dose. So we start off with 40 milligrams and it's a tapered dose every few days. So by reducing 10 milligrams every day, it's an immunosuppressant. So just be mindful, you don't really want to meet people with coughs and colds and things like that, because it can increase your risk of developing an infection. So just be mindful of that. And then these dressings are due to come off later on in a couple of hours. So I'll do a separate video on that. When we're using those, when those come off, I've been given some dressings to put on, just to put on the pillow, just to make sure that any oozing and things like that is contained within these dressings. So yeah, so the next video is going to be done once all this comes off.